What is vaccine and how does it work in a child's body?
Vaccine is nothing but a weakened bacteria or a virus or part of it.
Can you name few vaccines which are given in first 5 years?
Hepatitis B right at birth.
So who decides this schedule then?
So it is the regional health authorities.
What can be the side effects of these vaccines?
Child is having high spiking fever, or if he has inconsolable crying. For example, I will just give you the example of nephrotic syndrome. Now this is a kidney disease, and here we use steroids as the primary medicine, and it is used at a higher dose. You are giving so many vaccines, it will overwhelm my child's immune system. Doctor, I did not receive so many vaccines. I did fine. Why does my child need so many vaccines?
So why are some vaccines essential or mandatory, and then at the same time there are some optional vaccines?
So first and foremost, I would like to just clarify that there is nothing called as optional vaccines.
There is a separate section for vaccination when someone is traveling.
Yeah, this is very important, Dr. Amitabh. The travel vaccines are very, very important. We actually suggest to parents that they should meet.
Namaste everyone, welcome to yet another episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a podcast where we try to identify simple topic, complex topic, common topics and try to understand it directly from the experts in the field. Today's topic is something which affects all of us directly or indirectly, vaccination in children. Now when the term vaccine comes to our mind, you must understand that vaccines have saved millions of lives in the modern era. It is one of the greatest success stories in the modern medicine. However, vaccine has also sparked lot of debates, confusion, fear, lot of misconception. Many a times parents feel whether all the vaccines are needed, whether all these vaccines can be given together, what can be the side effects of these vaccines. Today, to clear all this doubt, I am very happy. I am joined by Dr. Kalpana, who is a leading pediatrician who has guided lots of families and parents about the vaccines. Today, she is going to discuss with us what is the role of vaccine in preventing the disease, whether it prevents disease only in a person or it can prevent diseases in community. She is also going to clear doubts or misinformation, various myths related to vaccines. So whether you are a parent or a young adult or someone who just want to know what vaccines are, how do they work, this episode is important for you. And I am pretty sure by the end of this episode, you are going to gain something extra knowledge. Thank you, Dr. Kalpana, for accepting the invitation to come on the podcast. Dr. Kalpana, can you tell us something about your background?
Sure. First and foremost, thank you, Dr. Amitabh Kulkarni, for inviting me to clarify doubts on this very important topic. I am a consultant pediatrician practicing in UAE since 2003 after having been trained at a very prestigious children's hospital in Mumbai, India, where I worked in a faculty position for over 10 years before moving to Dubai. And in my current position, I look after children and all their problems, be it immunization, routine childhood illnesses, as well as illnesses which require admissions in the wards.
So we are very lucky. We have experienced person to clear every doubts related to vaccine. So let's start the discussion. Dr. Kalpana, what is vaccine and how does it work in a child's body?
Right. To understand this, we have to know that when a child gets sick, he is infected with a microorganism, which could be a bacteria or a virus. Now, what is a vaccine? Vaccine is nothing but a weakened bacteria or a virus or part of it, which when administered in a child's body elicits an immune response. It affects the child's immune response and it produces protective response in the form of producing antibodies. So the child gets protected from the illness. Not only that, it also causes the cells of the body to remember this response. So certain immune memory responses are built up in the body, so that if your child in future is exposed to the same organism, there would be a boosted response and he'll get better protection.
So is it something like eliciting the same disease in the body which will help
Yes.
in protection for long term?
Yes, you could say that.
Yeah. So many times we see parents worry about too many vaccines, especially early in the life of a baby. So are those really needed? And many times we space them out. Sometimes we give it together.
Sure.
So what is the rationale behind all this program or giving too many vaccines too early in the life of a child?
Right. So in order to understand that, we must remember the fact that vaccination is region specific. When I say that, remember that if you are living in India versus you are living in UAE or in a Western country, your immunization schedule is not going to be the same. So immunization schedules are made depending on the prevalence or how common the infection is in the community. Why are we giving it so early? Because as we know, children's immune system is weak. It's still being built up. Over a period of years, they will come to the adult level of protection where they can themselves fight infections to a better extent. So hence, to protect these newborns or infants, we have to start these vaccinations early. As far as giving a lot of vaccinations is concerned, we are lucky now to have combination vaccines, as all of you know.
Yeah. Now, when you said that it is a region-wise, the schedule is different. So, who decides this schedule then?
So it is the regional health authorities and the expert panels who sit down and really look into the data. A lot of epidemiological data is surveyed.
Correct.
It has been checked regularly, and it's an ongoing process, because it's not necessary that what infections we dealt with 20 years ago are still the same in the community.
So, the disease profile is changing era-wise as well as region-wise. So,
And
that is how it is modified.
Yes, and that is one of the biggest achievements of vaccinations.
Right.
It is said that it is one of the most important discoveries of the 20th century. Not for nothing. It has really reduced the rates of very life-threatening infections. What we used to see when we were residents and what horrific complications we used to see, we don't see them anymore.
Correct. Now we see like maximum vaccines child receive in first 5 years of the life.
Yes.
So what is the rationale behind that?
Right. So in the first 5 years, the national immunization schedules have a certain fixed requirement of the basic immunizations that a child should receive.
Okay.
So in the preschool era and the early school days, he is protected for the common infections and the infections which are very potent to cause severe problems. So that is why maximum concentration is in those 5 years.
Yeah, so since we are in UAE, can you name few vaccines which are given in first 5 years for most of these
children? In UAE, starting with BCG and hepatitis B right at birth, we go on to give vaccines at 2, 4 and 6 months, which are 6-in-1 vaccines protecting against polio, diphtheria, pertussis, tetanus, H. influenzae, hepatitis B. Along with that, we give an injection for pneumococcal vaccine that protects against pneumonia, and rotaviral vaccines. So by this we complete about till about 6 months, and then we go on to give at 1 year the MMR, which is measles, mumps, rubella, and chicken pox vaccine at that age. 1.5 years and 5 years is the booster vaccine.
So I'm sure the number of vaccines have increased over the period. What we have seen 20 years back, 30 years back are totally different from now. So do you see a lot of apprehension amongst parents, because maybe they have not received so many vaccines, but their children are receiving a lot more vaccines than they have heard of. So what is your experience about that?
Yes, absolutely. Parents come and their concern is exactly as you stated. Doctor, I did not receive so many vaccines. I did fine. Why does my child need so many vaccines?
right.
So I would say that today's children are luckier to have so many vaccines at their disposal. They can make use of it, and they can be better protected. So what we don't look at is the number of mortality cases, number of deaths that happened in the era when these vaccines were not available. So the mortality rates were very high, and morbidity due to chronic infections was also very high. All that is being prevented. So these children are really lucky, and I think if science has advanced and given us so many wonderful tools of prevention, we must use it.
Yeah. So viewers, please understand, many vaccines is actually a boon for us. There were so many diseases patients used to die because of that, which are now totally preventable with use of these vaccines. So what are the common myths you have seen in this early period when you are advising so many vaccines, and then parents are maybe hesitant, but then of course we have a lot of information floating around from various sources. So what are the common myths you have been encountering or patients are discussing with you?
Yeah, so one of the very common things that they come and discuss is that you are giving so many vaccines, it will overwhelm my child's immune system. So this is one of the common things that we sit and discuss about. And the other one that is always brought up is MMR and autism. Yes, apart from that, we have to really sit down and discuss in detail about why we are doing what we are doing, so that they are put at peace and they are going ahead and taking an informed decision about vaccination.
So you said something about MMR and autism. That was actually my next question. So where did this come from, MMR and autism?
Right. So this was in 1998. There was a study published by a medical doctor, and it just blew up the world of vaccination from there. Subsequently, it was realized that that study had a lot of methodological flaws, and there were conflicts of interest. In fact, the doctor who wrote it was barred from practicing because it was not a good clinical practice what he did. And this, no one could replicate these kind of unfounded things ever again in any part of the world. So repeatedly it has been underlined, highlighted, spoken in detail about this, and I would take this opportunity today here to clarify any doubts there are in any parent's mind that MMR does not lead to autism. It could very well be that the symptoms of autism were apparent around the same time as the vaccination was given, and it was mere coincidence, but it was blown out of proportion and led to a lot of harm.
So maybe this was misinformation even before social media era, and that actually complicated the things. So according to you, it does not have any direct correlation between the vaccine, said vaccine, and autism. That's very, very reassuring for everyone to know that. Now many times, not just about vaccines, but parents nowadays, everyone is well educated, they read everything, what are the ingredients of the vaccine, and then we see lot of preservatives in those vaccines, whether it is thimerosal, aluminium, or any other preservatives, and I'm sure parents may have some concerns related to that. So do you want to clarify that? Is it really of concern in these vaccines?
Sure. No, it is not of concern. These are essential ingredients, yes. But say let's take aluminium for example. Aluminium is actually going to enhance the effect of the vaccine, and it is used in very, very small proportions. What we fail to understand is that our children are being exposed to these things in the environment, in the food.
Also. Yeah. Right.
In a larger quantum. So this is to be understood. As far as the preservatives are concerned, they are for the safety of the child, because say you have a multi-dose vial, you need preservatives so that there is no growth of harmful germs in that. So that is a protective strategy. So be rest assured that none of these ingredients are going to cause harm.
So this is also again reassuring. Parents, please understand these preservatives are essential. In fact, even a simple canned food which you buy at grocery store may have some preservatives, and this exposure in vaccine is nothing as compared to what the child is exposed otherwise. Now, Dr. Kalpana, you just mentioned there are combination vaccines. Now,
Yes.
why these combination vaccines was developed? What was the rationale behind those combination vaccines?
So, in fact, that has been really good because if you see over a period of time, the number of diseases against which we are protecting children routinely has increased. And giving a combination vaccine helps us in that, because otherwise we would have to space them out individually, and it would be even more visits to a doctor's office to get all the vaccinations completed.
It would be an inconvenience to both patient,
Absolutely.
parent as well as you. So,
Yes.
yeah. So doesn't it overwhelm the immune system of
No,
a
the
child?
fact to remember is that vaccinations are introduced into the market after a number of years of research. These things are studied, whether the individual vaccine which are put together are decreasing the immune response or causing any side effect. And also the important point is that even after introduction of a vaccine, there are continuous surveys going on, post-market surveillance, and the vaccine adverse effect reporting system is an ongoing process, no matter whether a vaccine was introduced 1 year ago, 5 years ago, or 10 years ago.
Right. So these are the time-tested vaccines with proven safety.
Absolutely.
So can you name some few vaccines which are combination and which is being used either here or other parts of world?
Yeah, so in the beginning what we give, the 6-in-1 vaccine, that is there are a lot of trade names, like you have Hexaxim, you have Infanrix Hexa, then we have 5-in-1 which is given at the first booster, Pentaxim, Tetraxim which is at the second booster. Apart from that, nowadays we have the MMR and varicella combination vaccine available, which is Procod, and there are many others.
Yeah. So thank you very much for clarifying. Now, once a patient or a child, I would say, receive a vaccine, what are the common side effects they should be watching for, they should be prepared for, and at what stage they should know that okay, the side effects are not just stopping here, and we should seek experts' opinion.
Right. So, the vaccines, the common side effects that we see are redness, pain, swelling at the site of the injection if it is an injectable vaccine. And also,
is it seen in almost all patients?
No. In fact, over a period of time, the vaccine methodology has really been refined, and we have lesser side effects than what we used to see.
Vaccines.
Absolutely,
Okay,
than what we used to see before. And apart from this, fever is a common side effect. Again, not seen in each and every child. So, mild low-grade fever may be there. In some children, the fever goes up high. Now, the second part of the question is, when should I seek help? So, if after vaccination, the child is having high spiking fever, or if he has inconsolable crying, he is not responding adequately to you, or he actually has jerks. So these are some of the serious side effects that one would definitely seek immediate attention for.
Yeah. And what percentage do you see the serious side effect?
So these are very rare.
Very rare.
Very rare. So the studies would say something like 1 in a million, but really they are pretty rare.
So most of the cases like redness or pain at the site or low grade fever, body ache, myalgia and all may be normal.
Yes.
But the signs which you shared, every parent should be watching for, and immediate attention should be sought with your doctor for the same. Now there may be many children who have, say, chronic condition. He may not be a healthy child. He may be harboring some chronic condition or some allergy condition. So how do you handle vaccination in those children?
So now there are two components to be understood here. What the condition is the child is on any chronic medication, and whether the condition itself predisposes the child to develop certain infections more than any other children.
Correct.
So these aspects have to be taken into consideration. For example, I will just give you the example of nephrotic syndrome. Now this is a kidney disease, and here we use steroids as the primary medicine.
Correct.
And it is used at a higher dose. So it is very important to discuss with your treating doctor when this child can receive vaccination, and when he should be avoiding those. That is very important. Second example I will give you is a common anemia, sickle cell anemia. Parts of Africa, in fact, it is very common.
Right.
So now these children, their protective responses, especially what spleen, an organ inside our body, has to do, that is diminished. So they are more susceptible to certain infections, like be it pneumococcal, be it meningococcal.
Right.
So we should give extra attention to these children and protect them against these infections.
So you mean to say in such chronic patient or allergic, risk of not vaccination is probably more than the side effects of vaccines?
Yes.
That is why we should definitely vaccinate these
we should
people.
definitely vaccinate. See, vaccination, I would say a dictum is that every encounter with a child or a family, no matter for what it is, we have to get into the vaccination details and try, and because that is really going to help them a lot. Coming to the allergies, previously egg allergy was cited as a common reason for not vaccinating for certain illnesses. So again, the vaccine methodology has improved. Those things are no longer true. So whether when it comes to an individual vaccine, needs to be discussed with the doctor.
Yeah. So this is very important, whether the child is carrying some chronic kidney disease or chronic any other disease, or he is a healthy child. You should vaccinate the child. Of course, if it is a chronic condition, allergic condition, you have to take expert's opinion related to that. Now, Dr. Kalpana, many times we see hesitancy in vaccination, even in urban educated family, probably due to excessive information related to that, misinformation related to that. Now, what is your experience and how do you deal with this hesitancy in educated people, even with the regular vaccines?
Yes. So this problem does come up, and like you said, educated people are more likely to seek opinions online these days.
Correct.
And in fact, I would like to quote a study here, wherein the medical professionals actually went down and saw that it was only about 11 or 12 sources on the internet that had led to 65% of the misinformation.
Okay.
So the fact to remember is that if somebody starts or puts an idea out there without any scientific basis, without any references, but he's an influencer, right? So it is going to be spread exponentially. So the misinformation spreads much faster, and then I don't blame the young parents, young couples, because at the heart of the thing is they want to protect their children. So they don't want to do any harm. But the fact to remember is that your trusted pediatrician also does not want to do any harm to your child. So it is always better to read, to be well informed, but get all those things clarified with the doctors.
So this is again very important. There are good influencer, there are bad influencer. As a citizen, it is your responsibility to identify which one is good and which one is bad. And if you are not able to make any decision, pediatrician is there to clarify the doubt. Now, how do you address the fear then in these people when they come for vaccine? They have lots of things in mind. Yes, we should do, but at the same time, they are fearing some side effects related to vaccine. So how do you discuss with them? How do you address this issue?
No, Dr. Amitabh, in my experience, what I have felt is that sit down, give them extra time, explain the facts as they are. There is no attempt to hide anything over here. If they want to know what is a 1 in million risk, tell them so, but also show them that what it would do to their child and what would happen if you don't vaccinate, what are the chances of that illness. Once I lay down these details to them, believe me, they turn it in their favor. Quite often, if a couple comes, one may be in favor, one may not be in favor, the husband or the wife, and then it is better to understand what their fear is, what their questions are, and do our best to answer them.
So you mean to say communication is the key you discuss with your doctor in detail, you clarify whatever doubts you have in your mind, whether you've read it somewhere or someone else has told you. It is always better to clarify that from expert. Now, since you are practicing since long time, I am sure you have experienced all sorts of you have dealt with all sorts of parents and children. So do you remember any story where a preventable disease happened in, say, maybe one of your child, and which could have been prevented with the just a simple vaccine in time?
Absolutely. So I have. It amazes me actually to see that the severe life-threatening illnesses happen even when it is vaccine preventable.
Correct.
So in fact, it pains me to see that. So yeah, we've had a very well-informed, very well-educated couple who were informed that they should give meningococcal vaccine to their child, but they lost their child to meningococcal septicemia. That was really a tragic story.
Yeah,
So
it feels disheartening when
yes.
you see someone who was totally, the disease was totally avoidable, but just because of some misinformation, it could not be avoided. Now, Dr. Kalpana, when we discuss about vaccines, we always come across important vaccines and optional vaccines, essential vaccines, mandatory vaccines, and optional vaccines. So, why are some vaccines essential or mandatory, and then at the same time there are some optional vaccines? So, why this differentiation in vaccines?
Right. So first and foremost, I would like to just clarify that there is nothing called as optional vaccines.
Okay.
We should do away with this terminology altogether. Now, when we talk about essential vaccines or the vaccines which each child has to take, those are the vaccines decided by the local health authorities or the governments. Fact to remember here is, once they put it as an essential vaccine, the governments provide them free of charge to the population at large.
Correct.
So try and understand that this is not going to be possible for every vaccine. So that's why the science is advancing. We have newer vaccines that cover the infections which are good, which are very good, and they should be given. So a family can go out and spend a lot on a meal or a movie, but when it comes to protecting their child, isn't that most important? So even if the government is not giving it free of charge, even if your insurance is not covering it, discuss with your pediatrician and get your child vaccinated, protect your child.
So you mean to say, as far as possible, we should vaccinate whichever is particular for that particular age. Now, many of these optional vaccines, so-called optional vaccines, many a times they are advised when someone is traveling or something like that.
Yes.
Or there is a separate section for vaccination when someone is traveling. What is your take on that?
Yeah, this is very important, Dr. Amitabh. The travel vaccines are very, very important. We actually suggest to parents that they should meet their pediatricians once they have decided on a travel. Why? Because the travel vaccines are different for different areas. If you are going to do Hajj, it will be different. If you are going to a Southeast Asian countries, it will be different. So it is better to go discuss the travel vaccines with your pediatrician and take the vaccine.
Yeah.
Invariably, it is a common thing for us post-summer vacation to come across diseases like typhoid, diseases like hepatitis C, common jaundice. They could be prevented.
Yeah, that's again very important. Travel vaccines, if you are traveling to an unknown territory or a territory where the diseases are common, even if it is not common in the area where you are living, it is important to discuss with your physician, pediatrician before traveling. If any vaccine is needed, as Dr. Kalpana clearly said, that better to take those vaccines to avoid a simple disease. Like few vaccines which almost all of us have heard somewhere or the other, HPV, flu, rotavirus. But when it comes to the category, it comes as an optional vaccine. So what is your take on these so-called optional vaccines?
Yeah. So if I talk about rotavirus in UAE, it is not optional, but in many parts of the world, it is still not in the governmental schedule. But it is very important, because invariably the first 5 years of life, the incidence of rotavirus is high. So once the child gets this diarrhea, he is going to be requiring help. Many of them get admitted. So, the problems are there, and this could be prevented. As far as HPV vaccine is concerned, HPV vaccine is the first anti-cancer vaccine. So, in fact, the medical community is really excited to have a first antiviral anti-cancer vaccine. So, here I would like to clarify that it was first introduced only for girls, but now it is also recommended for boys. It is given between 9 to 14 years of age. Earlier you start, the better, and it gives good protection, so should make use of it. Flu vaccine, influenza, it is a virus which changes its, antigens every year. It changes its form every year. So hence a new vaccine is produced every year, and that is given as an annual shot.
Yeah. So even if they are categorized in optional vaccine, you strongly recommend these vaccines for all the children. Yeah, that was again reassuring. So now the last question of this podcast is what every parent should know, or what they should ask before entering your cabin, especially for vaccination, whether it is for a vaccine schedule or whether to clarify some doubts. So what is your advice to those parents who have lots of questions related to vaccines?
Yeah, they are most welcome to ask all their doubts before the vaccination is done. They can write it down and come to us, and
that's a nice idea.
It helps us also. So it helps them organize their thoughts as well.
Correct.
And few things that as a doctor sitting at the other end vaccinating children that we are interested in is your child unwell? Correct. Remember, mild illnesses are not a contraindication to vaccination.
Correct.
So sometimes I come across children who have missed a lot of doses, and when we ask them why, they say, my child had cough, my child had little runny nose. So remember, parents, that is not the reason not to vaccinate. Leave this decision to the doctor, and they will assess the child, because we do. We assess the children before every vaccination, and we decide whether they are, okay to go ahead and being vaccinated. So that is very important. It's important for us to know that are there any allergies. It's important for us to also know whether any of the previous vaccinations have given any side effects to these children. So if your child has suffered from any side effect, please let us know. From parents' point of view, they need to know what vaccine is being given, what is it for, what are the common side effects of the vaccine, what should they do, do they need, common question is, should I give paracetamol before vaccination? So no, we give them advice accordingly. And what happens if there is redness, what can I do for that? So all these common questions they can clarify with us.
Yeah, thank you very much, Dr. Kalpana. That brings us to the end of this discussion, but please wait, we have added one more section in our podcast from this episode onwards, and that is rapid fire question, or I would say one line questions, where our guest has to answer in just one word or one line. So Dr. Kalpana, are you ready for that?
Sure, I'll do my best.
let us try. Yeah. So BCG or hepatitis B, which is the first vaccine after birth?
BCG.
BCG is the first vaccine. True or false? Flu shot should be received every year?
Yes, true.
Yeah. Chickenpox vaccine, essential or optional?
Essential.
Oral polio vaccine, is it still given in some parts of the world?
Yes, it is.
It is still given. What is the single best word for vaccine? Is it just life-saving or overrated?
Life-saving.
And would you vaccinate your own child on day one?
Absolutely.
Yes. Thank you very much for a swift answering of these rapid fire questions. So this wraps up our episode for today. Friends, Dr. Kalpana came here and she has clearly explained what is the role of vaccine, what are the side effects of vaccine, what parents should be watching for, what are essential vaccine, what are optional vaccine. From today's talk, I understood that communication is very important between a parent and the treating pediatrician, because many times you come up with false information from unverified sources, and it is always advisable, me as a doctor or she as a pediatrician, it is always advisable to seek the opinion of the expert in that particular field. Now, as far as vaccines in children, I don't think there can be anyone better expert than a pediatrician. So always seek the opinion of pediatrician when you are concerned about vaccine, when you have doubts related to vaccine. I hope today's episode has clarified most of the doubts related to vaccine, whether you are a parent or a family member or anyone who just wanted to know about vaccine. If you still have any doubts related to today's discussion, you can write it in comments. We will be very happy to answer those or clarify those doubts. If you want any other topic by Dr. Kalpana in future, please do mention it in the comments. We will be very happy to welcome those comments. Remember, prevention is better than cure, and this aptly applies for the vaccines, which was today's topic. Dr. Kalpana, thank you very much for your time and the simple explanation for this. Friends, please share this episode with someone who is a parent or your family member who need to know all the information which we discussed today, or someone who has a false belief about vaccines. So definitely this episode will help to clarify those doubts. This is me and Dr. Kalpana signing off from today's episode. Take care of your health.